Between 2014 and 2015, 62% of hospital beds were occupied by older patients aged 65 or over. This is an 18% increase in emergency admissions of older people between 2010 and 2011. That's a 12% increase for the whole population. We estimate this to be a gross cost of £820 million to the NHS for older patients remaining in hospital beds who are no longer in need of acute treatment. In 2015, 72-year-old Heidi, who is considered an older person, calls 999. She was feeling dizzy and unsteady on her feet and fell when going to the phone. The operator takes Heidi's details and an ambulance crew is dispatched. There is a 50% chance Heidi will be taken to a hospital and a 75% chance that Heidi will be admitted to a hospital. Heidi wants to stay in her own home and not be admitted to a hospital. Heidi recently heard on the news that healthy older adults have a 14% reduction in leg and hip muscle strength and a 12% reduction in aerobic capacity, the equivalent of 10 years lost life if they have just 10 days of bed rest. Heidi is worried she will lose her independence. In early 2016, the East and North Herts Clinical Commissioning Group looked to commission a service that tackled the high level of ambulance conveyances and hospital admissions for older people. The East of England Ambulance Service Trust and Herts County Council worked together to develop a dynamic, integrated health and social care service, the Early Intervention Vehicle. It was decided to have an emergency vehicle staffed by health and social care representatives in addition to the services an ambulance or paramedic can provide. This would enable assessment of a patient's ongoing care needs and assign commonly needed equipment, resulting in care in the home where appropriate. This vehicle is useful for quick solutions, resolving falls or injuries on the spot without the need for a patient to be rushed to hospital. A joint health and functional social care assessment will be offered to the patient to identify whether their treatment can be facilitated at home if they require an admission to hospital, and whether the patient would benefit from equipment or social care support to optimize their safety and well-being at home. In 2016, Heidi calls 999 again. She has had another fall. The operator dispatches the early intervention vehicle. Heidi is relieved the vehicle staff are looking for solutions to keep Heidi at home and not conveying her straight into hospital unless it is necessary for the patient's condition. There is now only a 30% chance Heidi is taken to hospital. The added benefit of this approach is the opportunity to minimize the risk of further unnecessary and repeated calls to the ambulance service by immediately adapting Heidi's home and setting up support in the community. Ultimately, this will reduce the chance of further falls and injuries. In its first year of operation, the early intervention vehicle visited more than 1,000 people, and after following a 90-minute assessment, it was determined it was appropriate for 70% to stay in the community. Find out more by visiting www.enhertsvanguard.uk.